Hi there. Today is Wednesday. It's 4 o'clock in the afternoon, so I am officially 5 days post-op. I've been to see my surgeon and my orthodontic consultants at the hospital today for my first post-op review appointment. I was a bit nervous about being able to go because I've been feeling so poorly. And I've not really been able to get out of bed in the morning much before 11 o'clock because I've not been sleeping very well, and I've been feeling so sick, and I've had really bad upset tummy from all the medication, diarrhea that's been making me feel really weak. So by the time I've had a little bit of breakfast in bed in the morning, like some Weetabix or some porridge, I've ended up having to go back to sleep for a couple of hours because I just felt so poorly. So I was a bit worried this morning that 24 hours ago I stopped my pain relief medication by way of syrup form, and my husband went to the pharmacy and asked for advice because the syrup paracetamol and syrup ibuprofen, we thought maybe that was what was making me feel so sick. So the pharmacist suggested having it in a dissolvable tablet form, which was a relief. And I think the fact that I managed to be able to do that for the most part yesterday and this morning meant that I wasn't so nauseous this morning, and I was able to get up and shower and wash my hair and get ready to leave the house by 11 o'clock, which was I'm really pleased with that. Anyway, so I saw my orthodontic consultant first. She had a look inside my mouth, which was made a lot easier today because, as you can see, my swelling has gone down considerably. This time yesterday, I don't think she'd have been able to even part my lip because the swelling, my lips were almost inside out, the swelling was so bad. But anyway, she had a look inside at my stitches and said that everything looked good. She was really pleased with my oral hygiene, and was pleased that I was this morning I managed to use a toothbrush for the first time, just a baby, like a 0 to 3 month old toothbrush. I wasn't able to get right to the back, but I was able to get around most of my teeth, and I was able to do the insides of them as well, which is a really nice feeling. So she's pleased with that. So then she sent me off for an x-ray, and the surgeon reviewed the x-rays after that, and he came to see me, and he's really pleased with the x-rays, that everything's exactly how I would have expected it to be. There's a slight misalignment of my teeth, which they expected. Sorry, it's still really quite difficult to swallow. They expected there to be a misalignment, and there's just going to be a little bit of movement to do with my braces treatment over the next couple of months, which will sort that out. But all in all, he's really happy, and they're going to see me again next week, at which point they hope to be able to get my mouth open a little bit more, and the swelling will have gone down a bit more to allow that, so that they can have a proper look. I explained to them that I'd been really nauseous, and I've had really quite bad diarrhea, and I never suffer with my tummy problems whatsoever. I've got a really strong constitution, but I have been really poorly with it. Monday and Tuesday was just, Sunday and Monday were the worst days. Tuesday was a little bit better yesterday because I swapped my syrupy meds. But anyway, they seem to think that it was the antibiotics that was upsetting my system so much. And because they're preventative antibiotics and I'm showing no sign whatsoever of any risk of infection, they've decided to stop my antibiotics. So I should start to feel a lot better in the next 24 to 48 hours in terms of being able to eat a little bit more so that I've got a little bit more energy. I also said that they asked me about pain and whether I've got any feeling. I said that I can feel my top lip, although it still feels a little bit weird to touch. All around here, I can feel very like here is numb but tickly. Here I can feel. Here I can feel. Here is numb. Here, all the way across here is numb. Here I can feel, and all along here is numb. But when I touch it, it tingles, and it is constantly tingling a little bit. It comes and goes, almost like little spasms of tingling. And the surgeon's thrilled with that. He said that if I'm 5, 6 days after my operation, if I'm already starting to feel the tingling, then he's almost certain that I will get 100% feeling back in my face. Because obviously you take the risk that you're not going to get 100% feeling back in your chin, especially because of how they have to move the nerves out of the way. So I'm really pleased with that. They're also really pleased with how much the swelling has gone down. It's gone down a lot. Under there is still quite swollen and it's very bruised. And I'm not quite sure if you can see, I've got a lot of bruising down my chest here. And he said that's because of where some of the instruments that they use during the surgery kind of go down your throat a little bit, which will less said the better. I asked him about, I've got a mark on my head there. I thought when I first came out of the surgery that I'd got a spot, but it's not a spot and there's a hard lump underneath it. So I asked the surgeon today what it was, and he said that he put a screw into my forehead there, a titanium screw, because that allowed him to be able to measure within the correct millimeterage as to how far forward he needed to pull my top jaw. So that's all a bit wacky, the fact that I had a titanium screw in my forehead. I'm glad I didn't know about that before the surgery. The really bad earache that I've been suffering from is apparently to do with the fact that they've had to move lots of ligaments and stuff around while they did the surgery, and also my jaw is in an alien position right now, so it's got to get used to being in its new position, and it sets off all the little nerves and ligaments in your ears. They've banded me, double banded me actually, if you can see, like in a triangle. I don't know. You can see that very well on this side. And that is to help stabilise my jaw so that it will help to alleviate the earache. And I can tell a difference already. It's gone off quite a lot, so that's good. So yeah, that's about it really. I feel a little bit wonky because the swelling's a little bit worse on one side than the other. I think this side is more swollen than this side, but I can already start to see my better jaw shape. Just do a side profile there, on this side, which I'm really happy about. But for me, it was never always just about getting a nice jaw shape, so I felt better about it myself. That was a lot of it, but it was about getting my teeth into a better position to reduce the risk of future gum disease, being able to eat properly, and having stability in my bite so that I didn't get wobbly teeth. And the fact that this is all now feels so real now. I can see the difference it's going to make. I mean, my bite doesn't look brilliant because there's still work to do. But oh gosh, it's just so. Even though I felt so poorly, I I wasn't prepared for how poorly I would feel. I was prepared for all the swelling because I watched lots of YouTube videos. I wasn't prepared for how poorly I would feel. But I guess medication affects everybody differently. And it had a bad effect on me. But I think once I got over that worst day, Monday, Tuesday, it seems such a long time ago. And there's still a long way to go. Because I'm still lacking a lot of energy, and I still can't eat without looking in the mirror. I have to like have a mirror and shove all the food in, like porridge, scrambled egg, Weetabix and soup on a tiny little plastic baby spoon, which takes forever. So still having to do all that with a mirror, but yeah, the benefits are far outweighing all the negatives of going through the surgery right now for me already. So off to see the consultant orthodontist and the surgeon again next week, and hopefully in the meantime the swelling will continue to reduce and I will continue to regain some energy and hopefully get out of the house a little bit. I'd quite like to get out of the house towards the end of the week and maybe go for a walk or something. So that's the plan, that's the aim. So thanks. Anybody got any questions, then please feel free to email or leave them on here. I'll very happily answer any. Thanks and bye bye.